need to be trained in certain skills. One is communication. Documentation, of course, is part of our training, but communication. And also understanding sometimes the economics of healthcare. I think it would help because we need to be more and more conscious of making healthcare as cost-effective as possible. And if we can understand that, I think we'd be better at our jobs. But let me share something with the audience. Leadership was thrust upon me in 1985, when my only brother died rather suddenly of a medical condition. My parents were quite shattered, so I had to take over the hospital. And in the initial years of my leadership, I was horrible. I was abrasive. I was intolerant. I wanted things done today. I would shout. I would throw instruments in the theater if they didn't work. I mean, if I look back at those early years, I feel ashamed. And that was very poor leadership. And I began to read about leadership, management, how do you handle people? And my colleagues who were with me, because I was building a team, were amazing. They had the courage. They would come and sit with me at the end of the day and they'd say, Rita, your behavior was terrible. Why did you shout at that poor nurse? Why did you destroy her confidence? You could have said it differently. And I began to reflect on my behavior. And one management book I read said only cowards shout at their employees because employees can't shout back. And that I kind of carved on my heart and in my brain. And I began to work on my, what I would call weakness. And I had to discover, I realized that you have to lead by example. And only then can things start percolating down. It's up to me to set the tone. And that is probably one of the hardest parts of a leader, to set the tone and to lead by example. I think that's an extremely important lesson for all of us, because as doctors, we are leaders, whether we like it or not. We have a circle of influence. We are public figures. People look at us. You don't have to be sitting at the managing director's seat to be a leader. You are leading just by being a doctor, because people come to you with trust. And therefore, I need to have values that are non-negotiable. I need to be taught certain things. If I've not been told that I have to greet a patient, introduce yourself, I wouldn't be doing it. And to me, that's utter disrespect. And I was horrified when I was told yesterday that some of my doctors are entering the outpatient clinic and they don't introduce themselves. I thought, good God, to me, that's somewhere we failed. Our culture has been eroded. So we need to be taught these skills. Prof, I'm afraid we have to have these lessons.
I think you have hit the nail on the head. You have ended with manners, which is about, introducing